When I was a probationary firefighter, I responded to a medical call. And when I got to the house, along with my colleagues, I was met with a scene that will always be with me as long as I live. And that scene included a distraught mother and a deceased child. And it was one of the most traumatic things that I've ever been exposed to. And I was totally unprepared. My name is Ron Colson, and I'm the Occupational Health and Safety Assistant Chief for Vancouver Fire and Rescue Services. My primary responsibility is to keep firefighters safe and healthy. You know, it's no secret that first responders in general and firefighters in particular are exposed to things that not everybody sees on a daily basis. It's what we are expected to do in terms of the performance of our duties. So readiness is the term that we attach and have attached historically to physical readiness. Being physically fit, you know, you have an image of a firefighter as being physically fit and able to perform the duties, physically demanding duties. But readiness also includes mental readiness as well, and mental wellness. You have to be well enough mentally to be able to perform your tasks that you're assigned in the field. In the past, you know, even when I was a young firefighter, often traditional methods of managing stress and exposure to trauma were employed. And those traditional methods weren't always positive. They had negative aspects to them, alcohol consumption being one of them. One of our areas of need was an effective and an appropriate preparedness program around what our staff can expect when they're exposed to a particular traumatic event. And so what we wanted to do was to increase awareness, increase education, increase knowledge, increase skills, increase understanding, and so that we could break down some of the old images and so the old ideas around stress related to trauma exposure. And with that, we needed some tools. We needed a toolkit. So we asked the staff at the Canadian Mental Health Association to say, what can you help us with in developing that toolkit? What we came back with was the Resilient Minds program that basically touches on the physiological effect of the exposure to trauma, resiliency, coping, responding with respect to those in the community, reducing stigma. The whole piece around reducing stigma would allow our staff to better understand and be in support of each other and to present a new face. And I think we're starting to do that. We've really brought the exposure to trauma and the effects of it out of the closet and out of the back rooms of the fire hall and to the kitchen table, where it's discussed openly and supported by all staff.